All right, go ahead, take a seat right here for me.
Okay.
Right here. All right, so like I said, my name is student Dr. Kirk.
The patient is diabetic and did not eat breakfast this morning. She took her medication but did not check her glucose. Since the patient did not eat breakfast, she is at an increased risk for a hypoglycemic attack during the appointment.
So first off, I'm going to ask you a few questions about your medical history, and I'm just going to jot those down. Now, are there any medical conditions that we need to be aware of going forward?
Nothing much. I was diagnosed with type 2 diabetes way back in the day. That's it though, nothing else.
So type 2 diabetes, okay. And when were you diagnosed with diabetes?
I think about 10 years ago, maybe. It's been a while.
10 years ago,
yeah.
okay. And are you taking any medications for that right now?
Yes, metformin.
Metformin?
Yeah.
Okay. Did you by chance bring that medication with you? Like, do you know how much you take every day?
I don't.
Okay.
I have it at home. I can bring it.
Okay, yeah. So on your next appointment, would be awesome if you could bring that in with you, just so we can have that information. But you've had it for about 10 years. Now, did you take your medication this morning?
I did, yes.
You did.
I was in a big rush this morning to drop my son off to school, but I did remember to take the medication.
Okay, good. And then also, along with that, do you test your blood glucose every day?
No, not every day.
Okay. Now, you know about the last time you had your HbA1c levels tested?
I think that was back when I saw my doctor last, which was probably, 8 months ago.
8 months ago?
Yeah.
Now, do you remember what that value was that they gave you for that reading?
I think it was around 8. The doctor checked it and said I was well controlled. I was fine.
Okay.
Yeah.
Okay. And so I know you were in a rush this morning, but did you have time to eat breakfast at all before you guys left the house?
No, I was.
Okay.
Yeah, I was in a rush. I was also feeling a little nervous. I didn't want to get nauseous in here.
Okay. No problem. Just like I said, it was just a kind of a series of questions we'll go through. Okay, so I'll go ahead and I jotted down a few things, and so I'm going to go talk with my faculty real quick, and so I'm just going to sit tight. I'll be back in just a couple minutes, okay? All right, thanks.
Yeah.
What do you got going on today?
I'm just doing a screening this morning. I'm waiting on faculty right now, but so actually real quick, let me ask you a question. So my patient is diabetic, but she took her medication this morning, and like the last time she went to a doctor, her doctor said she's like well controlled and everything, and so I need to talk to faculty and ask them if they think I just need to do like a blood glucose test. I mean, what do you think? Because I mean, the doctor said she's well controlled and she took her medication.
Well, if you're doing something more invasive, I would say you should take it, but since it's just a screening, I would probably skip it, save some time. She's probably going to be fine. This appointment's not too long.
Okay.
The patient is at risk of undergoing hypoglycemia. The provider is responsible for knowing when blood glucose should be taken and what a safe range is to continue with treatment. The faculty is overseeing the student to ensure they safely perform the treatment and will be held responsible should a medical emergency occur. Beneficence. Acting to benefit the patient. We don't want the patient to have an adverse experience at their dental appointment. It is best to take all necessary steps to ensure the patient is comfortable for the entire appointment. Non-maleficence. Do no harm to the patient. Without taking precautions and skipping the blood glucose test, it could lead to a medical emergency.
All right, Cherie, so we're going to go ahead and get started. So the next thing that we're going to do is I'm going to do a oral cancer screening. And so I'm going to be feeling on the outside of your face and also along kind of your neck where your lymph nodes are, checking for anything like lumps or bumps or anything abnormal. And also,
why do you have to do that? I thought you were just going to look at my teeth.
I will, we'll be looking at your teeth, but also as dentists, it's our responsibility to check for head and neck cancer or oral cancer. And so that's part of our responsibility to do that. It'll be real quick. Like I said, I'm just going to be touching the outside of your face here and also along your neck. And then we'll go ahead and I'll take a peek inside your mouth as well, okay?
Okay, go ahead. I can't be here long. I'm really in a rush today. So.
Okay. All right. Yeah, well, it shouldn't be too long. I mean, are you feeling okay? You're starting to look a little pale and a little shaky.
I'm all right, but it's just getting, kind of hot in here. And I'm starting to sweat a little bit.
Okay.
Can I get a paper towel or something?
Yeah, here's a paper towel. Yeah, you're starting to look a little. Are you feeling okay? You're starting to look a little pale.
Yeah, no, I'll be fine.
And so,
Cherie, Jamie, go get faculty. We have a medical emergency. Dr. Turchi, can I get a start check from you for my patient? Awesome. So today we have a 30-year-old female that presents for a screening today in the clinic. She does not have any allergies. Currently, she is a type 2 diabetic. She's currently taking metformin, and she did take her medication this morning. However, after talking with her, she said she did not eat breakfast. There's no other contraindications to the screening today. And so I had a question for you. I wasn't really sure, her being a diabetic and taking her medication but not eating, how do you think I should proceed with this?
You should go check out the glucometer from the dispensary and take her blood glucose so that if her blood glucose is low, then you can give her something like apple juice that we have here so that so she doesn't have a hypoglycemic attack while you're doing the screening.
Okay, perfect. I'll go ahead and do that, and I'll consult with you after the reading as well. Thank you. All right, so I spoke with our faculty, and so we would feel more comfortable this morning measuring your blood glucose level just to make sure that you're at a safe level. Just because you took your medication this morning but you weren't able to eat, so we just want to make sure you're at a safe level that we can continue even though we're not doing anything invasive this morning, just to make sure that you're comfortable and you're safe, okay? Does that make sense?
Yeah, thank
Okay.
you for explaining that.
Okay, so let's go ahead and do that real quick. So I'm going to prick your finger here. And we're going to measure the level here. Okay, go ahead and place the blood right there. Okay, so, wow. So right now it's showing that your glucose level is at 65, which is actually a little low. We want to make sure that you're above 70. That way you're not experiencing any symptoms of like shakiness or going pale or even like passing out. So I'm going to go ahead and get you some apple juice so you can drink that, kind of raise that blood glucose level for you. And then we're going to actually measure it again before we get started just to make sure we're at a safe level. Okay? Let me go grab that for you real quick. All right, go ahead and drink that there for me. And now we're gonna take your glucose level again to make sure it's at a safe level. I'm gonna take that cup from you. I'm gonna prick your finger one more time. Okay, good. So it's reading above 70 now, which is a good place that we can go ahead and start with the screening today. So we'll go ahead and get started. And also, after we're done with the appointment today, I just want to make sure that we take it one more time before we dismiss you, just to make sure, again, you're at a good level to go home and drive. And then, just as a reminder, and I'll remind you at the end of the appointment, we want to make sure that before you come in for your appointments, we want to make sure you eat breakfast, just because you're going to feel better throughout the appointment. It's going to go more smoothly for you, and also it's going to be a lot safer, okay? Did you have any questions up until this point?
No, you explained it well.
Awesome. Okay, let's go and get started then.
Choice 1. Because the student did not take the necessary precautions, he put the patient's life at risk. This may have legal repercussions and may cause the patient to develop an adverse dental experience. The patient may not trust TDC or even any dentist in the future. Choice 2 is the ethical choice in this scenario. By taking the patient's glucose reading, the student was able to take necessary precautions to keep the patient safe throughout her visit. The reading also gives us a better idea of the status of her diabetes and if additional precautions will be needed for future visit.